Hello and welcome to the JCN Clinic Podcast Show. I'm Jessica.
And I'm Carissa.
And I'm so excited to have Carissa with me today.
I feel so special.
The OGs are back in the house.
OGs. It actually has been ages since we've done a podcast together. I think we're trying to work it out before like 6 weeks maybe, which is a long time for us.
Too long. I get withdrawals. I literally was. I was saying to Carissa before we started, I was like really excited about today. I was just like, yes.
We just need to book online chats more. Like I don't have podcast withdrawals. It's just talking to you withdrawals. Like the podcast can be neither here nor there.
Oh, so true. Although I do the podcast, there's you definitely bring a certain light to the podcast, and I never know what's going to quite come out of your mouth at points, and that's what I love about it.
Like to keep it interesting. It's actually funny. I had a client yesterday, and she had seen another practitioner in the clinic, and she listens to the podcast, so she will probably know exactly who I'm talking about. She booked a consultation based off a podcast that we had done with the other practitioner that she was seeing, and absolutely thought she was getting me. So when she got this really soft-spoken practitioner, she's like, where's this person from the podcast that swears like a sailor? It's like I booked with them. But in fairness, as it turned out, that practitioner was perfect for her at the time, and she loved her, and I absolutely love her as well. But it was just funny. I had her yesterday. She hadn't been to the clinic for like 5 years, and she was booking back in for some other stuff, and she's like, I have a really funny story to tell you. I'm like, yeah, no, definitely would have been a very big difference between me and her.
Oh, that's hilarious. What was your saying you said before when we were talking about where your new house is versus isn't?
Deep
with
south.
Being out. Yeah, that you were like, it's.
I wash my back with a rag on a stick. I believe you haven't heard that. Oh my God. Anyone who was a diehard Simpsons fan will know exactly what it is, but it's Cletus, the hillbilly, and he's like got his overalls on, and he's just got like a stick with a rag on, I think, and he's like washing his back. He's like, I wash my back with a rag on a stick. I use it a lot when I'm camping. Oh dear. Yeah,
oh my God, it's so funny.
It's a good
I think
one.
I remember Cletus now.
Yeah.
I can see him in my head.
Yeah. And anyway, everyone knows who Cletus is. Yeah.
Well, guys, we're going to do a Q&A today. Mm-hmm. We dropped a question box on Instagram. You guys hit us up with some goodies. I really like this mix, actually. So we'll dive into those. The first one from Teagues01 was actually regarding the Iron podcast that was released, not this one that dropped recently, but the one before, so 2 podcasts ago. That was a really weird way of saying just 2 podcasts ago.
I was like, what? She's going to get there.
She's getting there. Just a warning, and the last question, you'll hear more about this, is that like my brain is a little bit potatoes at the moment, so bear with me, listeners.
All
right, so regarding the Iron podcast, best blood test for inflammation if Hashies, so Hashies meaning Hashimoto's, low iron and low ferritin on a GF diet. Oh, that's why she's put it twice, because she forgot that on the end. So essentially, this person wants to know what are the best blood tests that she can get for inflammation because she has Hashies. I imagine this is what she means. She has Hashimoto's. She knows she's got low iron and low ferritin, and she's already on a gluten-free diet. So with that podcast, you can obviously go and listen to that, but a big part of that podcast with Rebecca from Activated Probiotics was about how inflammation is a huge underlying driver for low iron. It was a really good podcast. She had so many cool analogies. I just loved it. So that's why Teagues01 has flagged about inflammation, because she knows she has low iron and low ferritin. So that's the storage form of iron. But she's also saying she's got Hashimoto's. So I thought this was interesting. And I guess first and foremost, I'll dive into a few things maybe, and if you want to add from there. I guess firstly, I mean, she has outlined these, but I still, as a practitioner, we'd want to know exactly what we're dealing with. So put your phone down, Jessica, you don't need any more. It's like holding it like this, like it's going to absorb into my brain. For anyone, by the way, this is also now a visual medium. We are on YouTube. So if you want to see Carissa and my antics,
yeah, please just watch us.
That's where you can head to.
You don't even have to listen to us speak. Just watch the hand actions.
I know it's out of control.
Shit that happens.
So we would want to know first, like where you're at with these particular areas you just said. So we're going to run a full thyroid panel, ideally. So see what your TSH, your T3, T4, reverse T3, even if we can get that done through your lovely GP, and also your antibodies. So we want to know firstly, yes, you have Hashimoto's, but where is everything sitting? That's important for us first and foremost. We also are going to run an iron studies panel because we want to know, you're saying you've got low iron, but what does that look like? What do your transporters of iron look like? What does the ferritin look like? Because that's important for us, how we would also approach this. We also want to know about inflammation. So you've said, obviously, you flagged inflammation and Hashimoto's. We would include things like CRP and ESR, which are acute inflammatory markers. So that would be, for me, like a really basic starting point. Oh, and also a full blood count as well. So we can look at what are your red blood cells doing, as far as like there's a whole different breakdown of how we'd look at the blood cell volume and how your hemoglobin's looking, etc. So that side of things, it probably sounds like a no-brainer considering what you just said, but we still need to know that because that'll influence what we might do. But then on top of that, when we go digging deeper, this is where we would look at other things like, you said on gluten-free diet, when I read it prior, I missed that because I read the other one that didn't have that. So I was like, celiacs, definitely running a celiac panel. But maybe if you're on a gluten-free diet, you know, you might have put yourself on that and you feel better, but maybe do you know whether potentially you do have celiac disease, which is different to maybe just being on a gluten-free diet and not being fully strict. Obviously, if that is something we need to look at and you have been on a gluten-free diet, we need to have a discussion about bringing gluten back into your diet as well. But definitely celiacs would be something that I'd be questioning. Other things that I had written down when I had to think about this earlier were actually B12. Just essentially because if these things are low, B12 could also be low. But also if it is low, we want to think about the whys as far as B12 absorption in the small intestinal tract, quite high up. Maybe if that's low, that's going to be hinting at some digestive issues that could be going on. And then the other one that I'd thought purely blood was vitamin D, because that's going to have an impact on, if it is low, your immune regulation. So there were some basic bloods that I thought of. But the other thing, of course, for us as clinical nutritionists is going to start to step outside of this from blood. So we're going to be thinking about, well, you've got all of this going on from a testing point of view. If there's inflammation, often that inflammation is going to be impacting your absorption of iron, which is all about the gut. So really we're going to start digging with some functional potential stool testing or maybe SIBO testing, depending on your symptoms. That was my brain dump on that. I don't know whether there's any Rissy that I've like missed that you wanted to add.
I think you said everything. Did you? I know I can't imagine you were thinking, but did you say full iron studies as well to look at like iron saturation and stuff? Yeah, cool. I would add on to that, just because everyone knows I love it. I would add homocysteine into that.
Yes. Yeah.
So I would do B12 and folate and homocysteine. Again, just homocysteine, if it's high, it's also pro-inflammatory. So we'd be looking at how that methylation methionine cycle's functioning. I think that would be it. If I was being really and there was a family history that warranted it, I would probably be doing a full autoimmune panel as well. So beyond thyroid and celiacs, I might just do ANAs, SDNA, or even just rheumatoid, just depending on what the family history is, if there's other stuff going on. But that I think would probably, that would be maybe zinc if we were suspecting any gut stuff. But that's me just like literally adding on to everything you said. perfect. So,
Yeah.
but then if we were just getting extra, like, oh, have we got a great GP that wants to do everything? Well, let's add this on and have a look.
Yeah.
Yeah. I do
No,
think
that's
the gut stuff would be good. I was just going to say too, just for anyone listening, and I think we've covered this in another podcast, I screen the celiac genes a lot now if my clients are on gluten-free diet. So if you're on a gluten-free diet and you're just unsure your risk for celiac disease, you feel better on a gluten-free diet, you know you've got a lot of autoimmune in your family or you have autoimmune yourself, I will screen celiac genes for my clients. And 50% strike rate for the GPs that are happy to do it, but a good majority of them are, especially if there's autoimmune and someone feels better on a gluten-free diet, just to get the potential.
Mm-hmm, mm-hmm.
Yeah.
Yeah. No, they're really good add-ons. I love about all of that is it just shows how complex it is.
Yeah.
Like, you know,
Yeah.
just as far as all of the different avenues that we need to consider.
Yeah.
Love it. I love it. So beautiful. All right, let's move on to question number 2 from My Money Means. Cool name. This one is menstrual migraines 3 days before or after period. This happens every month, a little cry face. Fix ? Fix me, Carissa.
Menstrual migraines, they are actually super common. So there's headaches and then there's actual migraines. So I'm just going to assume that this person has proper migraines. Sometimes people will say they get migraines and they're just getting quite bad headaches. But either way, whatever you're getting, it's not fun. Definitely we are looking, there's a couple of factors to this. So definitely estrogen is first and foremost. And its sort of a role in the luteal phase is the biggest thing to look at. So testing that we'd be looking at if we can would be a Dutch test would be amazing. But even in bloods, day 3 to 5 hormones and potentially day 21, if we can do both, would be awesome just to have a look. So have a look at your progesterone and estrogen at day 21 when it's, all your hormones are doing their thing, but also when they're at their lowest at the start of the cycle, because you're obviously getting that person's obviously getting some headaches in that space as well. So we'd definitely be doing serum hormones, but definitely for the person who's asked the question, understanding your estrogen, where you're at in terms of, age and hormones, like life cycle or life stage is really important too. But understanding estrogen and what it's up to would be the first thing I would be addressing when it comes to migraines, which is crazy because a lot of people don't really associate estrogen with migraines. But as soon as their cycle, like to do with your menstrual cycle, we have to understand what your hormones are doing. Progesterone would be my next one, but usually we'll work out what progesterone is doing if we're investigating estrogen anyway. The next thing that I would be considering as part of that is how happy is your liver and how well functioning is your gut. Surprise, surprise, we're going there. But the gut and liver role in estrogen metabolism and detoxification when it comes to things like migraines is so important. So firstly, what is your estrogen doing? But how well is your body dealing with it is the next part. And that is so reliant on how well your liver is functioning and how well your gut is functioning. So when people come to me with migraines, they're quite commonly the areas that we're going into. So in an initial consultation, like if someone comes in and they're chronically constipated, I'm going to want to understand what their estrogen's doing. But first and foremost, we need their gut detoxifying, because if you're just loading up, and especially in your luteal phase, not detoxifying, and you've just got this toxic little environment in your gut that is not getting shit out, literally, we're going to have an increase in these symptoms with headaches and migraines and stuff like that. So gut, liver, estrogen, all very big to consider and worth evaluating and assessing in the menstrual migraine space. The other thing is food triggers. So migraines, again, obviously some people will get migraines from a food trigger, and it can be something like MSG or a sulfite or something like that, and it's not cycle related. Quite commonly, if they are cycle related, I will go through and have a good chat to my clients about what they are eating around this time of their cycle. Is there an increased histamine load of food? So quite commonly, not to demonize chocolate, but chocolate, obviously cacao being a high histamine food. If someone is getting menstrual migraines and they're going hard in with high histamine foods around that time, or they seem to have histamine issues in general, we want to be reducing that histamine load in the diet all the time or around the time of the menstrual cycle, depending on what is needed for that person, and working out where histamines are coming in and the role that they're playing from a dietary point of view. But beyond just the histamines in foods, are there any sort of like chemical triggers, MSG, nitrates, all of those things that you're just more sensitive to and are, more sensitive to at that time in your cycle? I think that's everything I would consider off the top of my head.
I think that ticked literally every box. Yeah,
Cool.
that was nice, complex answer, but very informative all at the same time.
Yeah. There's a lot with migraines. It is.
There is a lot.
Yeah, so much. And it's usually not just as simple as take some magnesium, which, if it was.
It's so common too. Like it's really, really common. And I think we see, I know we've talked about this in podcasts, but like it is one of those symptoms that's just sometimes is swept under the rug as far as, that's just normal. That's part of PMS, that you're going to have bad headaches and migraines. And I know even for myself, like speaking to that whole detox component, I don't have problems with them. I haven't had in ages, but I definitely used to have problems with headaches leading up to my period, but particularly other congestion, like I would consider, or we would consider those sort of classic liver congestion signs as far as that detox goes, like breast tenderness being a big one. And just, so as soon as I remember in those early years, as soon as I started to understand that and started to treat for that specifically, I couldn't believe the difference.
Yeah,
like 100%. I remember it
100%.
actually blowing me away in, I think it was back when I was actually studying, to be honest. Yeah, just like learning about that and going, oh, okay, right. And going in that direction and just being blown over the difference in symptoms.
100%.
Just like, wow.
Yeah, and like you and I, like we both got estrogenic, like, we've both got issues with estrogen. Like you've got your endo history. I'm definitely a 4-hydroxy maker. So if I don't know if you've ever done a Dutch test, but if you had,
I did way back when you and I think you and I did one together.
Cool. Yeah.
Way, the first time we did them.
Were you like 16 OH with your, like, did you
I haven't looked at it in so long, I can't remember, but the main thing I remember is that everything was I just remember laughing at it, which is so bad. I'm sorry, people listening.
Both our cortisol was
our cortisols were, but everything was really low. Like I expected to come back with my endo history to be like classic estrogen dominance, and it actually wasn't. Like I was just like someone just unplugged my hormones. And just said bye-bye.
Why are we laughing?
They just packed up and left. This isn't funny. I understand, listeners, it's not funny, but as a practitioner, there is a funny side.
Yeah, we can laugh at our own shit, literally. So
I actually, that's interesting. I wonder would we have done them through back then?
It would have been RN Labs because they're the only place that has offered. They've just changed their platform since our original one.
They probably don't have like old test results attached there anymore.
You might be able to source them though. You could, who knows?
Search by patient name. Anyway, I just thought, I am.
Now.
Yeah, literally on the phone. No, it's not coming up.
Bugger.
I'd have to find them somewhere. Yeah, it's just, I wish I could remember. I trust, if you told me I was 16 dominant back then, I'd trust your memory more than me.
I can't remember. It's just, I just know your history. So I remember us laughing at our cortisol because we were both going, oh my God, we're like pre-burnout picture here.
Yeah.
Going on. Yeah. But I can't remember what your estrogen was doing. But just classically, exactly what you were saying that is my reminder from my body when I need to regulate my detox or back off what the pressure that I'm putting on my liver in terms of stress and all the things, because the first thing I will start is I'll start getting headaches. I get migraines, but thank God my migraines aren't cyclical. My migraines are just migraines. If I get them, but I do get menstrual headaches. And that is one of the first things that will start happening when my liver, everything's just needs some support and some love. And same thing, all the breast stuff as well. So that's what I was going to say. Most people getting menstrual migraines or headaches, they've usually got other symptoms alongside that as part of their cycle picture. So, and usually when we clean all of that up, all of that can really settle down.
Yeah.
Interestingly, while we're on it, but like I get my mammograms done every 12 months, breast mammogram and ultrasound done every 12 months. And last year, between mammograms and ultrasounds, I'm due for my next one soon, actually. But because I've got very dense breast tissue and lots of cysts in my breast tissue as well. And I did quite a bit of work on my estrogen last year. And interestingly, because my boobs can be so fucking symptomatic to my cycle depending on what's going on. So much better in, these years. But when I was younger, oh my goodness, like couldn't even put a bra on to train sometimes because everything would just be so swollen, sore and hard. But I definitely don't get that anymore. But I still do have fibrocystic breasts. And so from the last mammogram to the one that I had done November last year, my cysts had significantly decreased in size. And I could still feel them there, and I'm interested to see again 12 months on, because I've been doing a little bit more work and just working on things like stress and, all the things, just, I wouldn't say I've reduced caffeine intake. I'm just mindful of not ODing on caffeine the way I used to. So even and alcohol, like all these little things that I'm just getting better and better at not having in my diet or my life, and regulating stress and, doing estrogen detox work, like all of those little things, like I know play such a big role. But I'm interested to when I get my next mammogram, because I can feel some of the cysts that I know cause me a lot of pain, and I can physically feel like they have decreased again. I can feel that they've decreased over the last 12 months with the work that I've done. So I'm interested to see if the mammogram and ultrasound reflect that again. So
yeah, no, that'd be so interesting.
Yeah, because the lady said to me, she was like, geez, she's like, these cysts have really decreased. And because she had my other scans up, and I go to a clinic, it's just a Queensland x-ray, but they do it all at once. And the radiographer is there on site reviewing everything. So if you need to do a biopsy, they do it then and there. You don't go home and wait for your doctor. It all happens on the day. So they pull up your old results, previous, compare and contrast everything. So if something has changed, or they come back, and then they'll re-ultrasound and make a decision whether or not you need a biopsy or what's going on. So there's no sort of anxiety around the waiting periods of stuff. But yeah, they actually came back and they're like, your cysts have decreased significantly from your last mammogram and ultrasound 12 months ago. What have you been doing? I said,
let me tell you.
What haven't I been doing, Dad? Oh, I didn't say too much. I said, I've just been looking after myself. Yeah. So anyway, so that's just interesting. But alongside the migraine side of things, usually there's booby stuff happening as well.
Yeah, so true.
Yeah.
Excellent. Let's move on to this next question. I'm really curious now about my Dutch results. I just found the section. It's like archived, and it's got all of my old stool results, and it goes right back to 2016, but there's no Dutch there.
It has to be there. It'd have to be there somewhere.
So weird. Like it's got it's got the old stool tests, like the old ones, two of those, and then a GI data. 360.
Yeah.
Yeah. Anyway.
It has to be in that time, because I started working for you in 2015.
Oh, okay. So it's not like, I was like, it's, the days when we just got it mailed, but like it came in the mail.
No. Because we did doctor's data, the original doctor's data stool testing together as well.
Yeah.
Not together, guys, holding hands in the same toilet, but around the same time. Don't worry, Jess, I got you, girl.
Jay, okay. You're holding my little container. Just a little bit to the left.
No, so we did that, and I think we did a Dutch like a little bit later or something.
Yeah, that's what I thought.
That would definitely.
It's weird that it's not on there. I might harass them about it.
Do it.
Okay, we're going to move on to Fiona Louise. This is a loaded question, Fiona Louise. Thoughts on the biphasic diet to help clear SIBO? So, the biphasic diet is a diet that was created by Narala Jacoby many years ago. Way back. Well, I guess even those dates you just mentioned, I know that it definitely existed, probably existed or came in around that same time.
Yeah.
Because I remember us, talking pretty heavily about it in those sort of initial years. So it was created by Narala with reference to helping with SIBO treatment, and the whole concept of it is to be very low in fermentable substrates that will feed bacteria, similar to the way you might think about a low FODMAP diet, but a lot more extreme, because it's not only about the types of foods that you're excluding. There's also, well, I guess the FODMAP does this to a point too, but it's very, very strict with like portions. And it has phases, hence the name biphasic, where there's a very strict phase to start with. And then when you are considered ready to move on to the second phase, you would then progress and be able to allow more things in. So it's not a diet that has no merit. Let's just say that. Like, it definitely it has its place, and it had its place. However, it's very, very, very extreme. And we learned this through clinic by utilizing this diet with clients. Two things. We learned very quickly that the majority of people don't need this level of an extreme intervention with diet, that a lot of people can get progress with SIBO without such an extreme intervention through diet. It's a very small percentage of people that need to be this extreme at all, like very, very small. The second factor that we found clinically, and I'm sure other practitioners can relate to this, it is really triggering in regards to poor relationships with food. So if you come into this type of treatment with any form of past disordered eating, or you even have a tendency towards that, and you're put on something that is this extreme, it can create so much stress and anxiety and trauma around food that it can be really damaging. Which I know probably sounds like a pretty full-on thing maybe to say, but I'm saying we, but like, because Carissa and I had discussions about this, it was something that we saw firsthand. And it's even something today that we are very aware of at the clinic with regard to any form of diet, in quotation marks. So whether that be low FODMAP or anything that we're doing that creates rules and restrictions around foods can be really triggering for people. So that's something that I guess with the biphasic in particular that concerns me, because it is so extreme. But to go back to the first point, I think I could count on one hand, like, and there's been so many clients over like the massive, like you said, say the past decade, that I think truly needed something that was that severe as an intervention with food. And also, it is a biphasic diet. Like, Narala did create it with the intention of you stay in this area for X amount of time and then you move on. But people, when it comes to the gut and these gut issues and just your health, people get so scared of food. And also when they find relief and they feel better and they associate a way of eating with that, they get so scared of pushing the boundaries. So people would stay in this restrictive phase instead of moving on to where they were meant to. And even as a practitioner, trying to budge people to move out of that. And again, we still struggle with this today if we have made some amendments to diet and then we have a massive reintroduction that we do always with our clients to broaden their diet out again. And not every client, but a lot of clients find that very hard, because when you're in a safe place and you're in your bubble and all your symptoms have pretty much gone or regressed, and then your practitioner is saying to you, okay, now we're going to start challenging XYZ, you're just like red flags all over the place. So it's an interesting tool, but I think that it has been definitely overused and probably caused a lot of potential. I mean, I guess when I say damage, like haven't even talked about how that would affect the microbiome long term as well if people were sticking to it long term as well. Because again, like if you are living your life by the rule, by something like the biphasic diet, and you haven't moved through it correctly, or have been in that biphasic diet for too long, it is very damaging to your microbiome overall because of the reduction of fuel that you're providing your gut. And then unfortunately that becomes a vicious circle, which we've talked about before on the podcast, where you're just so like SIBO, 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 and then to the detriment of like your gut overall, you have narrowed your fuel load so exponentially that now you have this really poor diversity of bacteria in your gut, and that opens you up for a whole load of other health complications. And that's where it becomes this vicious circle. Yeah. So
Yeah.
I don't know if there's anything you wanted to add to that. I mean, I'm really, I don't want to say that it's like the worst thing that was ever invented. I know that like it was created by Narala, and she's also made other versions of it. Like there's been vegetarian and low histamine versions, and revisited it for those reasons to a point. But yeah, I think it's really important to not, the last thing I'll say is it's really important with any diet like this to never ever do this on your own.
Yeah.
Like if you have these gut issues and you're thinking about making changes and utilizing a diet, you need to do it with guidance.
Yeah. I think I think it was, and it is a diet that, I think this is the thing for people to remember in the health space too. The biphasic diet was brought out like a decade ago. And at the time, it probably was the first of its kind, apart from a low FODMAP diet, that really addressed SIBO as a complex condition. And also gave SIBO a seat at the table in terms of, complicated digestive disorders. Like before that,
so
it was
true.
a relatively unheard of condition. Like we in the natural health space knew about it. And I think, Narala went in and designed something for people that weren't getting relief on FODMAPs that was stricter. So exactly what you said at the start of what you were saying, it had its place at the time for sure. But as clinicians, as we move through and try things and utilize them in practice, we learn what works well and what doesn't work well, and where things, just have a place versus how much space they really kind of need or deserve in the space as well. But the other thing that's worth mentioning is that over the last decade, our understanding of SIBO has really changed, and our understanding of the microbiome has really changed. And I think that's where the issues with the SIBO biphasic diet I feel like, apart from what we've just seen ourselves with it being too strict and too triggering for some people and all of that, and maybe it's, most people will get relief on a good low FODMAP diet without the strict exclusions. And we've talked about that before. But I think what's happened is that, over the last decade, a lot of people have used it, exactly what you're saying, used it on their own at home without the guidance of a practitioner, or it's been used by practitioners and it's kept people in the really strict phase for too long, with really high doses of antimicrobial herbs and things like that. And, and without the understanding from other clinicians that if someone's not getting better on a SIBO biphasic diet, you don't keep them on it for 2 years and just keep hammering their gut. There's something else going on. And that's, where our understanding of the microbiome and everything has evolved over the years, you need to keep up as a practitioner. Even just our understanding of, hydrogen sulfide and, that and how that's changed over the years. Like things we were talking about 8 years ago are different to how we're talking about it now. And so I think, I agree with you. It had its place, and then we definitely used it. But I think now as a functional tool, I don't really feel, unless someone has really chronic SIBO and under the guidance of a really knowledgeable practitioner, it would be something I would use straight away to treat SIBO. I think there's a lot of other things that, like other dietary tools and supplements and microbiome testing that I would use first before I use that in this day and age.
Yeah. Yeah. 100% agree. Interesting too, as you just highlighted again, that the time frame of when this diet was actually created and how much has changed in a decade. Like, I'm sure if
so
you
much.
spoke to Narala, like how she feels about the biphasic diet now as she did to then and how she treats, I'm sure there's been a exponential leap. I haven't even looked at the biphasic diet online in a very, very, very long time. So I couldn't even speak to how much it has changed to the old days. But it did used to be available online. Like, you could just go on and download it as a PDF for free. And like, that's where the problem I think lies. So yeah, it's a really interesting question. And if in some chance that Narala Jacoby listens to this podcast, by no means are we bad mouthing her. She's amazing.
She's
amazing person, amazing educator. And as you said, like, groundbreaking at its time, and really I love that analogy. Yeah, brought it to the table. Because prior to that, SIBO was kind of like this thing that we're like, what? Like, really? You and I remember we used to joke about it, like, way back. Well, this like, just
we were like,
what?
We'll give this a couple of years before
this is a fad.
We acknowledge that this condition exists, because you know, I remember it was just coming onto the scene when I was finishing my degree. And there were some practitioners that were just gung-ho in the SIBO space, you know, and everything was SIBO. Every gut symptom was SIBO. And you and I, like, we're a little bit more, as soon as something, you know, we're like that with everything. As soon as something becomes a trend, or not a trend, but, you know, it hits the ground running and it's the be-all and end-all, we like to sit back and watch the cards fall a bit too. You know what I mean? Exactly. And we were definitely like that at the start with SIBO. But then, of course, like, as research emerged, you know, people started talking, understandings of the microbiome, and it definitely is a thing. And Narala really brought it to the table and put it on the landscape, which I think was so valuable at the time and still is valuable to this day. But our understanding again of the microbiome has changed so much, and there's different testing and anyway,
I think the thing I've heard her say, lastly, again, I haven't listened to her in quite a while, but I do remember her speaking more and more about the fact that SIBO is, in majority of the cases, a symptom of other things going on, which I think is really important, like, with context of all of this. Like, it's rare that it does happen just on its own, and it can, but usually it's because of other factors that are going on with your health and your guts. Anyway, let's leave that one there and move on to the last question. So we left this one to last because it's a little bit more lighthearted, from one of our long-term amazing listeners, and that's Tanya. Hi, Tanya. She said, I'd love an update on where you and Carissa are at with your fitness and training. Do you want to start? Do you want me to start?
I'm easy. You can start if you want. I feel like, because I don't talk heaps about mine on social media, so people are like, anyone following is probably a bit more aware of what you're doing. So you go.
Yeah. Okay. I guess we did actually, it was quite a while ago, we had a chat about this and the differences around nutrition. So some long-term listeners would have known your background and, like, I guess, sort of the health association too with your training. But myself, where I'm at with my fitness and training. So in short, in short, 2 weeks, today's Friday. 2 weeks from now will be the 28th, if I'm correct,
correct.
Let me just double check. So 2 weeks from now, I will probably be about 3, I think it starts at 8, maybe about 4 hours, 5 hours into the COSI 100. 2 weeks. So my training and fitness is probably, to be honest, it's at an all-time high. I've been training all year for this. I've definitely had other races along the way. But I was saying to Rissy before we started, I'm right now in the middle of, like, the highest part of the build, which was last weekend and this weekend are kind of like those long runs. So last weekend I did a 2-hour run on the Saturday and a 5-hour on the Sunday. So the idea is that, like, you're building time on feet, but, like, you're also doing it through fatigue. So that 5-hour run, obviously and this is in the mountains with elevation, but that 5-hour run is on tired legs from the week. So it's trying to make your body feel like it's going to feel at 60, 70 Ks, which is very hard to do.
It's just crazy to me.
The training is really building, and then this weekend I'll have another weekend like that, and then from there I will start a taper. So I'll still be training, but the load will drop dramatically. I won't be doing those long runs on the weekend anymore. I don't think I do anything over an hour and a half next week, and then I'll start having more rest days in between as it will build or taper right off until the race itself. So yeah, fitness wise, I mean, I feel pretty bloody fit, to be honest. Like, it's been pretty amazing. Like, one of the reasons I went into this and love it is just I'm fascinated by what the human body can do. I guess it's part of, like, you know, what we do as a job in a different way. Like, it really fascinates me what the body can do, but also what the mind can do. And you can't do this type of training without already having those types of challenges. Like, it's not rainbows and sunshine out there all the time. Like, there's moments where like last weekend on that 5-hour run was a great example. Like, it was 5 hours. It was raining, which I actually do like running in the rain, but like it got windy and cold at points. And there was some points when I was like, I got somewhere where there's meant to be a trail and the trail's not there, or I was slogging it up this massive incline and I just started to feel nauseous, and I was just like, I felt really heavy in the legs. I was like, fuck this. What am I doing? Why am I doing this? This is stupid. Like, you know, that the negative stuff comes into your head, but you have to, in the moment, it's like finding a space where it's like, this will pass, like this, you know, this, and this is what you learn. Like, it's a moment and you just keep putting one foot in front of the other. And even if you have to slow down a bit, like, it will pass and then you will feel better again. And that's true. Like, an hour later, I'm on a downhill and I'm like descending and I'm running and I've got my arms out and I'm like, there's no one around, but I'm out loud. I'm like, woo, like, just like a child, you know, because it's so much fun to just run downhill and you go through these ups and downs. And that part of the training has been really valuable. Like, that's what people say with trail running and ultras. Like, it's that stuff that you learn that you bring to life, you know. It's like being in the moment and learning that the shit times pass. So yeah, it's been really interesting, the training, as far as not only the physical but the mental. And also I've definitely had to navigate these last few, probably since July, like having an ITB issue and working through my first real sort of injury in quotation marks and coming out of that, and then having that flare up a bit this week has been another little mental battle. But yeah, I know, I mean, I could talk about it till the cows come home, but I think, like, overall, like, I'm really happy. If God, I can't believe I'm saying this out loud. Because it's all like the stuff in my head that it's like the fears stuff, but I'm like, oh wow, you are happy, Jessica. Like, I am really happy with where I'm at and what I've done to date. I am definitely, am I scared? Is that the right word? I don't know what the right word is. I have fear about the race. Damien has said to me more than once these last few weeks, he's like, you know, we'll be proud of you no matter what. Like, you don't have to finish. Like, we're just proud of what you've done. And he's like, I know you don't, he's like, one of the things I love about you is you don't care what other people think, which is true. Like, I care about what my family and my, like, work colleagues and the people I love think about me, but I don't care about the average person off the street. He's like, I know you're not doing it for that, but you know, if you don't finish, that's okay, which means a lot. But like I said to him, what drives me is that I care. Like, my worst probably critic is myself. So I want to finish it for me. Like, I'll be disappointed and I joke about it, but like, it would take me having to break a leg or something significant to happen for me to not finish. Like, if I have to crawl to that finish line, I'll get myself over it. But the thing is, I do want to do it and feel proud of the accomplishment. Like, I think not anyone can finish it. That's a shitty thing to say. Like, it's not easy to do it, but
Yes,
I
you're
want to
doing
do it and feel
100K.
proud.
You're doing 100K ultra. Not everyone
No,
or
no.
anyone can do that.
But I could like walk it, right? No, I probably couldn't because I'd get kicked out. Like you've got to meet certain times,
Yeah.
but I just want to do it in a time that I'm proud of and that in it, I have my ABCs. Like, I'd love to do well in my age group category. There's certain spots, if I could come in like the top 50 females, it'd be freaking amazing. Like it's a very, very big race in Australia. Like all the elites are there. Like it's going to be mental just to even see that. But yeah, there's a mix of fear about it because it's the unknown. If I drop down to do the 50, I would not have that fear because I've done it before and I feel really confident in a 50 now. But yeah, there's this fear that I'm carrying around the unknown and like how my body's what's it going to do after 50 Ks? Yeah, Chris has got her hand up.
I want to ask a question, but I didn't want to interrupt you. How did you feel going into the 50 last year comparatively? Because that was also the unknown.
It's such a good question because it's the same.
Yeah.
I was terrified in this. I was excited, but the same like terrified feeling because I just didn't know. I was like, I don't know whether I can do this.
Smashed it.
And I do remember in the last aid station saying to Damien, this is the hardest thing I've ever done in my entire life. Oh man, but you're right. Like that's what I keep thinking about. I'm like, I felt like this about the 50. It's the same thing. It's just a little different. And, you just don't know what it's going to feel like. And I do have a coach. I have had a coach for the last, I don't know whether it's been 6 months yet, maybe a little under. And that's probably been the most valuable factor because I trust her so much. Like she's very accomplished in trail running in Australia. And yeah, when she has belief in me that I can do it, or when I'm freaking out about the fact, like if she's said to me about instead of doing 5 hours this weekend, she's like, I think you should just do 4 with like what's going on at the moment. And I'm just like freaking out about that. And I'm like, no, I need the confidence. She's like, you're good, you're fine. Like it's more important that you've done everything now. Like you've done everything you need to do. Now we need to get you to that start line feeling the best and healthiest that you can. And yeah, just that knowledge, but that kind of belief from her has been really helpful. So yeah, it's really been an amazing journey, and it's like I'm not even at the race yet, but it's very emotive. Like and I think that's why I love it. Like there's times out there. The last thing I'll say about that is, yeah, when I was out on Sunday and I was in the last sort of couple of Ks running down the mountain and I was listening to Taylor Swift's new album, and I'm not really a Swiftie, but my sister and my niece like love Taylor Swift. I'm like, I'll listen to it. And I was running out and I was having fun and I was thinking about them and just about her being like, particularly my sister, and about my niece being like proud of me. And I was just like tearing up running. And I was like, that's what it's about. And I remember that with Cozzy 50 at points, like just thinking about my family and just like about them being proud of me and setting like a good example for the kids. Like I want the kids to feel like you can do whatever you want, like do whatever you want. And that like makes me feel really happy and proud. And people say in ultras, you've got to find your why, because when you're out there, you'll have these times which you do, where you're like, what the fuck am I doing? You idiot. This is so hard. Or your body's screaming at you, your brain, your body, like everything's breaking down. And it doesn't make sense from a health part. I know that as a practitioner. My creatinine is going to be probably through the roof when I finish. I'm going to be weeing tar. Hopefully not, people. But yeah, it's just you've got to find your why and your purpose so you can think about that. So that is what keeps you going. So that's where I'm at in my fitness journey.
So good. I'm so excited for you to do it. I have no doubt that you're going to do it. So for me, it's like, I don't know, just because I've known you for like over a decade now, gosh, nearly 12 years, but I'm like, I don't know what it's going to be like out there on 100Ks. Fucking hell, like 50. We watched you on the little thing on the 50, like just where we can, me and Steph were watching it. So yeah, I think you'll just go out and do amazing. And Yeah. And then you'll just go and do it next year and you'll just do better. Like, I'm like not even worried for you.
Oh, I love you. Thank you.
I'm not though, because I know like your brain, and I know how prepared you will be for this. Like, that's what I
Yeah.
mean. Like, there's people that go out, and we've talked about this before. I think you've mentioned it as well. But like, you know, there's people that go and run ultras and will go and do a 50K with bugger all training. They'll injure themselves, like, or they'll just go and smash their body and then spend, you know, months in recovery. Like, just all these things. Like, people tackle these sorts of events so differently, but you're so methodical. You've done so much work. Like you said, you've got a coach. I watch you with all your fucking gels, like, and your carbohydrates, you know, your calories that you're eating. Like, I'm just like, if anyone is just going to go out and do this well, it is going to be Jessica Cox. So, you know what I mean? So unless like the fucking endurance gods have any other plans, which is totally out of your control anyway, I'm not even fucking worried for you. That's the way I look at what's going to happen in 2 weeks. So
Oh, thanks, Rissy. That means a lot. I'll think of that out there.
Literally, you have got this. And like you said, though, it's like your little wire, like just Zaya at the finish line. And does Zaki go as well, or is it just?
Yeah, well, Zaki was there last year,
Okay.
but Zaya wasn't.
Oh,
I don't think those guys will be there this year.
Okay, but
Yeah,
still, like, just
but
that.
it'll
Yeah.
just that. Yeah, it's just knowing.
Yeah,
Yeah,
that you can come and tell them about it, or like Kirst might be tracking it somewhere, and there'll be photos, like all those little things. Yeah, exactly. But no,
yeah.
I think your training's like insanely cool to watch. So yeah,
That just reminded me, Frankie, who's my niece so Carly's kid. Carly was telling me they were at a store recently because Frankie's gotten, well, she was, I don't know if she's not, she might have fallen out of it because she's a bit all over the place with her interests, but she was like really getting into running, and I'd go for runs around the block with her, and she wanted to get the night gear and the pack, like everything like Auntie Jess, which was so cute.
Yeah.
But they were in a store and she was getting something for Frankie, and Frankie saw the Pure Sports Nutrition gels there, and she knows that I use them. And she was like, oh, look, Mum. And she said to the person in the store, my auntie uses these and she's an athlete.
Well, you are.
I'm not an athlete. My auntie's an athlete and she uses those. Like, oh, God, I would have turned bright red if I was there.
Be like, not me, the other one, she's not here. Oh my God. Well, I feel like you are close to athlete level with the amount of training you have to do. Like, if someone looks at the definition of athlete, I feel like with what you're doing, that's pretty much on par. My God.
How about you? That's enough from me.
Sorry, don't mind my reaching in the back there. I had to put it on mute before too, because we've got some baby. Are you right, Bug? Are you okay, baby?
That's randomly dry reaching.
Yeah, dogs, man, they just spew their little ferals. Are you all right, baby? She's such a princess. And I had to mute it before too, because you were talking. We've got these baby butcher birds at the moment. You'll hear it when you listen to this back when you're doing the audio stuff that you do. But this baby butcher bird was just in the background. So shut up, Jess is saying something cool. So I had to mute. The mum's just obviously digging worms out to feed them. What am I doing at the moment? Far out. I'm just trying to think. Definitely not as much as you. My training is very just routine at the moment, actually, which I'm actually enjoying because I've had 18 months of rehab to get to it. So I walk every day, which is great for my body, and depending on where we're at a while ago, but for me to get back up to walking 5Ks a few times a week with my bone disease in my leg and the injuries that come from that is quite a feat. So I'm actually really happy with where I'm at the moment. I've got a pretty good balance between pain levels and movement. So I can walk 3 to 5Ks most days, which is great for me. Good. So good for me. I am very mindful of load, and I have to just be with how much I load my right side up with anything. So the nature of my bone disease just means that it can just flare for no reason, and therefore all the muscles and everything around it flare. But anyway, I think compared to maybe last time when we chatted about this, or even if I think back to this time last year, I'm in a very different place. I'm very well managed from a pain perspective. I've worked a lot of things out. So anyone who's done really intense rehab for anything chronic will understand. We were talking about this before we jumped on. It's so much of a management process. So I can walk every day, which is great. That's a non-negotiable for me. It just really depends on where I'm at and what else I'm doing, how far I will walk. But I can get a couple of 5 to 6Ks in at the moment, which is awesome. And then other days I just do a lazy 3Ks, because compared to what I was doing before all of this happened, like 3 to 5Ks is sort of small on the Richter scale, but I'm thankful for it. So, so 3Ks is every day, and then I'll just do bigger walks a couple of times a week if I can. So there's that. I do Pilates 2 to 3 times a week. I'm doing reformer at the moment, which again, for my body is amazing. Jess and I have talked about this behind the scenes. Like I've fallen in love with Pilates so much that I'm studying it, because for my injury, what do you call it? Like just my body, I've done some good shit to it over the years, and coming out of injuries has just been really hard. But Pilates has really been the turning point for so many things. And for me at the moment, like if I do Pilates, go to and do a reformer class 2 to 3 times a week, my body is just so much better in everything that it does. And it also has allowed me to go back into weight training, which I can't weight train without Pilates. That is just, my body does not allow it.
Wow, they've got to be together.
They've got to be together. And I think it's just, obviously when I learn more about the why for Pilates, I'm sure I'll understand this a bit more. But if I have a couple of weeks off Pilates and just walk and then try and do weight training, my body just fucks out. Like whether it be my back again or it's all my right side for me. And I think it's because I have this bone disease, and I think honestly it just causes inflammation. It just shortens and tightens everything. And now that I understand that probably was a big reason why my back issue wouldn't resolve 5 years ago. Anyway, even though there was an injury there that I did to my spine. But anyway, all that shit aside. So I do Pilates 2 to 3 times a week, reformer. I have a weight session set up. I do that usually 2 times a week. So I'm doing some sort of strength training 5 times a week. Majority of the time, it's not perfect. Obviously, life dictates otherwise. And I'm just doing the Ash Freeman Elevate program. So it's just dumbbell weights at home, and they're 28 minutes. So they're half an hour, and I do a lot of fucking stretching and yoga. Like Pilates, it's just a non-negotiable. I've been a bit slack with that lately, and I can feel it in my body. So yeah, that's mine. So I walk every day. I would say, unless it's raining, I don't not walk. Distance varies, and I'm doing some sort of strength, whether it be Pilates or a weight session, and some stretching. So I have quite a big, it sounds like a lot. Well, it's not as much as what Jess is doing, but it's definitely, I would say, a good hour to hour and a half dedicated to.
Yeah, it's still a lot.
Yeah, but I feel good at it, which is good.
It's great. Like it is. It's a huge jump from where you're at. It's so positive to hear. But you can see that you've found what's working. Like it's such a mix of like there's the cardiovascular stuff and like you're walking, which you love, but so much of what you've built is all around the complexities of what's best for your body and that rehabilitation process, and just keeping everything fine-tuned. It's just, it sounds amazing, like how you've like meshed it all together.
Yeah, it's how I have to. My body tells me so quickly if I'm dropping off. And it's almost like sometimes I have to just really, like what we say with like just the mental game of it, I have to never look at it as a chore. Like I love exercise, don't get me wrong, but my body's very quick to tell me if I pushed it too hard or if I haven't done enough. And I don't have much wiggle room if I want to like perform, but if I want to train at the level that I'm currently training at, which is, some sort of strength 5 days a week, some sort of cardio, and I don't fuck around when I walk.
No.
So, and there's hills and stuff in there, and I do a little bit of it. Like I'll ride my bike when I get a chance, or get in the pool and go for a swim. But if I want to keep that level of training up, there's a lot of non-negotiables in terms of other things that I have to do to look after that. So, it's like I said, like I would love to go out and run a trail, like go back to what I was doing. Not that I was doing your distance, but I just can't. My body won't allow it. So I just have to drop it and get over it. And I would love to probably do more and heavier weights, but I just can't. My body won't allow it at the moment. Like it just, I've come so far out of this, injury, disease, inflammatory recovery fucking roller coaster to get to here, that I just have to be really respectful that I've come so far in the space that I'm in, and just be grateful that I'm actually here, because 2 years ago, I wasn't even close to this. And 2 years ago, the option was go on pain medication, which happened with my back 5 years ago. Go on pain medication. Don't worry about it. Just move to your standard and we'll do surgery if we need to. Yeah. And to me, that's just so far removed from a space I want to be in. Like, I'm not opposed to doing surgery, and I do take an upper level of anti-inflammatories if I need to. But I barely take them at the moment. Like, I had to take some this week because I've overdone it this week. But I'm pretty good. I don't have to take anti-inflammatories to manage most of the time, which again, 12 months ago. That's a huge
difference.
18 months ago, like, I could barely get through a couple of days without Voltaren or something. Yeah. Like, obviously I stay away from all the codeines and all that stuff. I don't want to be in that space, but I have, So I feel like I'm in a much better place than I was. I just have to be respectful. Of what my body, especially my leg. And that's what someone else actually asked a while ago, because they said they'd heard me talk about it on the podcast. And I've never actually said what goes on. Someone actually just thought I had osteoporosis. When I say bone disease, my bone disease is called myelorostosis. It's a rare bone disease, which means that the long bones of my body grow lumpy and spiny. Or they sort of candle wax stripping is the analogy if you ever look it up for anyone listening. And it means in the long bones of my right side, it's not in my left side, thank God, but on my right side, the long bones grow. It's kind of like they just grow. The best way to say it is all bumpy and knobbly. So then you think like that's, for anyone listening, like that then presses into the muscles, but also restricts like blood flow, nutrient flow, and all of that. Like, there's just this whole sort of cascade of inflammation that can happen and flare up. So that happens. I'm pretty sure I've got it in my shoulder because I can actually feel it.
Really?
I can feel it in my leg. Like now that I know what it is, because you can feel the bones swelling at any given time. It's there. It's just how much it flares the muscles and tendons and all and my knee up around it. But I can feel it in my shoulder. Like, I've got a big nodule there, and you can, so I'm pretty sure it's in my arm as well. I can't be fucked to go and get a scan, because what are they going to do?
Yeah, it's so true. Like, I know what I need to do. I'm already doing it.
Makes no difference. And this shoulder really, it flares up the way my leg does as well, that arm. So that's right. So that's what actually happens for me, and that's why this has been such a road. Someone said the other day, "Oh, you just got osteoporosis. We've heard you talk about this," and I'm like, "Oh no, actually." No,
yeah, exactly. It's huge. Like, if anyone has heard you talk about this, previously, that's a massive jump, and it's great. Like, do you feel generally happy with where your training's at now? Like, or do you feel are you frustrated by where you're at now, or are you actually like, no, I actually feel really good. Like, this is doing what it needs to do, and I'm happy with it.
I would love to be doing more, but I think my lesson is learn to do less. And I think that has been the big theme from the universe for this whole, because I'm always trying to, like, not that you need to, find the reason in things, but I do joke that the universe had to slow me down. And, because I am someone who will push my body to 150% and just go. I do it in every aspect of my life when I want to. And I think this has been the big, if you don't slow down, you're going to fall apart lesson. And it's forced me to do that in so many ways. I can't even, I don't even walk slower than I used to walk. Like, it's just, because I used to walk at such a pace that I'd be out of breath just trying to have a conversation with someone. And that was my normal. I would say, am I happy with where I'm at? I'm thankful for where I'm at. I would like to be doing more, and I would like to be able to push my body a bit harder, but I have to go slow. But I am happier in general because I'm in less pain and I'm better managed. I think anyone who lives with chronic pain, it just takes so much out of you. Like, it is honestly one of the most debilitating things. I don't know. Well, there's obviously a lot of debilitating things, but chronic pain, and I've spoken to other clients who have had it or live with it, it is such a mental game in terms of showing up and being a nice person every day and all these things that you just, you're just constantly living with something that is just draining you and just putting you at dis-ease all the time. So to have a run of time where my pain levels are a 3 out of 10 the majority of days, as opposed to a fucking 8 or a 9, that just makes me such a nicer human.
Yeah.
Like, I can look at the world again and I see the beautiful colors in the trees, and I notice the little bugs, like all the things that I know when my body is in a place of peace. I notice, I feel aligned. I feel there, which is nice, as opposed to just getting through and holding on for the ride. So that's probably the best way to put it.
No, that's so nice. It's kind of, I obviously knew that you'd been training more, but it's really nice to get that full update as well. Like, it's a really massive shift from where things were. And it's easy sometimes, isn't it, to like forget where you've come from. Like, we see it with our clients, and like, even with this is such a good example. It's just like how far you've come, and being like really proud of like what you've achieved, and particularly with that whole 150% go mind frame to be able to like pull that up and like catch yourself out and go, no, this is what I need for me now, and this is what works for me now. Like, it's not easy.
No, and it's good just to have the reminder, like, I have my days as I know you have your days, and it's just good to have your partner in your corner reminding you, like me, for, like what you were saying before with Damien, with you, like Mick, for me, he's just that positive person in the corner that if I have my day where we'll go for a walk and my leg's just not having it, and I have to walk home after a K and a half, and he keeps going with the dog, and I'll just walk home and I'll just have tears in my eyes, and I'm so frustrated, and I'm limping down the fucking road, and I'm like, I'm 41, I shouldn't, this is unfair, and you just have your woe is me moment. But Mick will come home and he'll just be like, and I'll just be like frustrated and angry and upset, and he'll just be like, he's like, 2 years ago, babe, you couldn't even walk. You're on crutches. You were staring down the barrel of a completely different diagnosis, which would have been even more terrifying, or surgery or something like that. And you have rehabbed and fucking nutritioned your way out of this.
Nutritioned. I love it.
So sometimes it's just good for someone to go, you're doing all right. Fuck up and get over it. And you do need to do that sometimes. You just got to take your fucking pill of self-sorrow, swallow it, and get the fuck on with it.
Oh, God. They're good for that, aren't they? They can drive you crazy, but, like, they can be really good for that.
Really just like, you're all right. You've come a long way. Give yourself a bit of credit. Dust yourself off. Get on with it.
Oh, man. Oh, that was really great. Man, I thought I was leaving like the lighthearted one for the end, but maybe not with all of that.
That's our training. Well, we're both going through big life-changing events at completely opposite ends of the training spectrum.
That's it. Oh, well, I know we haven't done them for ages, and I haven't even thought about it because I've had other people on here, but we were in the habit of doing recommendations, and I tell you what, I haven't given it a thought before, just thinking about where we're at in the podcast right now. So at the moment my brain is thinking, I go straight to like, what have I been watching lately and what have I been loving? I tell you what I have been watching, which I only ever remember weirdly Steph mentioning it to me in the last year or so, when The Bear was really popular. The TV show The Bear, about the chef.
Oh yeah. I love that. Yeah, I've seen it.
Yeah. So I brought it up to Steph. We must have been mentioning about it, and I was just like, oh, such great acting. I've never really seen any of them before. And she's like, oh, the main guy is out of Shameless. I'm like, what's that? And I'm like, oh, I've seen. I had never seen Shameless. So the last month or two, Damien and I think there's 11 seasons. We are in an absolute binge every night of Shameless. I'm like, how have I never watched this show? This is one of the best things I've ever seen in my life.
Oh my gosh, Shameless. Oh, I can't even. I just absolutely loved that series for so many reasons. My God.
It is just, there are just no words. Like, it is just like a piece of art.
It honestly, that's the way to describe it, because you can't, there's just so many complexities to that series that just make it so fucking good. Like, Yeah, no, I've watched Shameless. Andy, my sister-in-law, actually got me because there was someone she likened to out of Shameless, actually, and I was like, "What are you talking about?" She's like, "Shameless, haven't you watched? How the fuck have you not watched Shameless?" And I'm like,
Yeah,
"What?"
yeah.
She's like, "Oh my god, you have to watch it." I just fell in love with it. Same as you and Damien, I binged it. Yeah,
Oh, so
so good.
good. Yeah. So if you've never watched it, the weird thing is it's one of those things that you see come up on Netflix, or even like you're on a plane flight and they have like the TV shows that are popular. Like I've seen it for years. I'd seen the picture of the kind of like the main image they use. And for some reason, I don't know why, I was always just like, meh, like didn't really read into what it was about. So
yeah,
if you haven't watched it, this is my and Chris's obviously.
so good.
Our sign to you that, yeah, it is just a brilliant show. And if you're looking for something that you want to just get lost in for like weeks and weeks on end, because there is literally, I think it's either 11 or 12. We're nearly going into the last season. So yeah, it's pretty cool.
I think the reason it wouldn't appeal to a lot of people is because at face value, it just looks a bit ochre and redneck, if that makes sense. Like if you just watch the adverts and you know nothing about it, you're like, why would I watch this? But it really gets your heart. I tell you, like your heartstrings and just the situation this family is in and the adversities and.
But it's so funny too. That like it's
so funny.
The humor is like it's so quirky and it's
just
not
so
like
done.
they say the things that you shouldn't say. I don't know whether like you could make Shameless now. I don't know. Maybe there's some shows that do this a little bit, but it definitely, you have your jaw dropped constantly with the stuff
just
that comes out of, particularly the like Frank out of Alcoholics mouth
Frank.
that you're just like things that you just don't say.
That's the dad's name, isn't it?
Yeah,
Frank.
Frank.
Yeah. I watched it for ages.
Yeah.
It's
so it's just that the
PC.
heartfelt stuff, the humor, like the love, the family love. The relationship that Damien's just like, oh my God, you're obsessed. Like I'm so obsessed with like the relationship between Ian and Mickey, like that have just been each other's sweethearts since high school, but just so like you haven't watched it in so long, but they're just about to get married at the moment. But it's just beautiful, like such a beautiful show. So that's my recommendation. Is go back and watch that.
My recommendation is I'm in my I'm reading a lot of books at the moment in my spare time, and my recommendation, I'm going to say this, be with caution, but it is such a brilliant novel, is The Nightingale. It is by, I'll just tell you who it's by.
That's an older book, right? It's an older book or no? Maybe not. It's not. For a minute, I thought you were going to like talk about some sort of fairy smart book.
No. I haven't got into that yet. I've got, Andy swears she'll get me into it, and I've got one sitting there, but I haven't got there. The Nightingale is Kristin Hannah. So she's obviously a female writer, but she wants to tell the story of women in war. Like, so she's actually written a couple of books. I've got another one of hers to read, purely because of how much this one just, anyone who's read it will understand. So this is a book about two sisters in World War II in France when the Germans invade, and they're just their two life stories throughout the war. I have no words. So that is my recommendation, but like for days after finishing it, I just couldn't stop thinking about it, and it is just soul crushing, but also beautiful.
Wow.
And so she's got another book I've got there to read. My mum's read that one too, and she said, just prepare yourself. It's on par. That one's called The Women, or The Woman. Anyway, so I've got that one there to read, but The Nightingale, literally, like I just have no fucking words for that book.
Wow. Okay. When was it written? Like, when was it? Is there a date on it there?
Let me have a quick look.
I don't know why the name's familiar. I definitely haven't read it. Maybe it's just other people have told me about it.
Maybe, yeah. Like I popped it up on social media a while ago, and so many people are like, oh my God, I read that.
Right.
But let me just see. Read more. How do you tell me something? I can't tell.
Can't find it. That's cool. That's all right.
Paperback, 2017.
Okay.
It says 10th of October 2017, but I don't know. That's just what Amazon says, so I don't know what. But yeah, honestly, like just so well written. She is such an amazing writer, but like I couldn't put it down.
Wow.
But then when it ended, I was just fucked up for days.
Oh. This is such a sign of a good book. Like you read it all the time and you just don't want it to end, but then you just like can't stop thinking about it.
Days. I literally texted. I couldn't even text Andy when I finished it because I was still in such a whoa. And then I literally texted her the next morning on my walk. So I was like going for a walk and I'm like, I finished the Nightingale, dude. I have no words. She's like, I fucking told you. Another good series actually of books that I've read is so Colleen Hoover, she wrote It Ends With Us, which everyone knows. I haven't seen the movie, but I've read the book and I'm currently reading It Starts With Us, but not that book. She has a series called the Hopeless series. And it starts 5 books, but 3 actual books and 2 like sort of half books. Yeah. And it is very worth reading as well.
Right. Okay.
Yeah. It's definitely not on the same landscape as the Nightingale, different, but just some real like, holy fuck moments, especially in the first one. And then the other ones intertwine with it. They're just the other stories of how the first one, characters sort of intertwine. It's their stories. But as a series, I can highly recommend that as well. If you but trigger warnings with those. Trigger warnings with the Hopeless series. Prepare to have your soul crushed by the Nightingale. Prepare to
get your soul crushed and then go and like have a laugh and watch Shameless to get rid of the bad.
Exactly. I had to go and read, like I'm reading some other ones who Mel from Elixir Naturopathy, her and I chat online a lot, Mel Briggs, and we both swap books and stuff. And so she got me onto is it Emily Henry? Anyway, she's more of a rom-com writer. So I've had to go and just read some really light love stories where they're funny, but you know that a couple's going to end up together just to unfuck my soul before I go back and read her next book.
You just got to. You have to.
Yeah, exactly.
Wonderful. Well, I hope our listeners out there have enjoyed today's episode. I feel like we have absolutely covered everything and beyond today.
Yep. Hope you enjoyed it.
Yes. As I said, we're on YouTube. So I think probably all of this year, roughly. But if it's you're into watching podcasts, you can head over and find us there. Have a little subscribe. We've got some fun videos over there too. Some really good little foodie nutrition videos. And if today's episode has floated your boat, we would love you to share it on socials. That really helps other people find the podcast. And just to take a moment to give us a rating on iTunes would be amazing. Other than that, we loved having you here and thank you so much for listening, and we'll catch you next time.
Bye.
Bye.